the science of sleep as we know it really began half a century ago. Up to a third of Americans, 100 and some million people, are affected by problems with sleep at one time or another. Sleep is something that everyone does, and yet it's so poorly understood. We still don't have a comprehensive understanding of the most basic questions. Why do we sleep? How do we sleep? How does that actually happen? We still don't have a complete understanding of that, not even close. The fact that we still have these big unanswered questions out there, that's really what keeps me going.
Here at Cleveland, at Case Western Reserve University, I was recruited in 1980 because I was interested in respiratory control. We've had active research in sleep apnea since that time. And as sleep medicine developed, we had one of the first training programs. And then we have had a ACGME training program since its inception. I think what we want to be able to present to you is what this fellowship is all about. It's certainly one that is a year-long practice and principles of sleep medicine.
One thing that is really exciting about our field is that we really are within still the first couple of generations. The people who literally invented the field are, in some cases, still alive, still teaching, still practicing.
Here you have the opportunity to work in 3 different labs, dealing with 3 different patient populations. Just by virtue of the fact that the fellows are rotating between the 3 institutions, they get plenty of exposure to patients from all sorts of walks of life.
Between the 3 major institutions here, you have not just really big, robust programs, but really, really good people. And some of those people are literally the founding members of sleep medicine. This is not just a place to get a world-class education. This is a place to develop relationships that are going to last a lifetime. These are colleagues who will be in the career at your side as you continue in your practice of medicine.
In this program, the pediatric part, Dr. Stroll laid out a continuum of pediatric rotations throughout the entire year. And so you really spread that knowledge. I think that's a great way of learning, because then you can still piece and part what you're seeing in adults and what you're seeing in children, and as they grow up, how that transition of care becomes. Even if you're going to be an adult sleep doctor, you're going to need to know what happens in their pediatric life. I still love to see adults because I love to see the spectrum of ages. Pediatrics is so much more challenging. So I still want to grab all that sort of spectrum, because if not, I think we lose something. My hope is that sleep medicine continues to augment its presence and the science behind it.
The research that we've been interested in for a long time involves the management of sleep apnea. We're working with Sometrics, which is one of the companies that is developed something called CNEP, which is negative pressure around the neck. And this device will go into clinical trials next year, and we will be one of the lead centers for this. So why would you do sleep medicine? Well, the first is that you're interested and intrinsically engaged in sleep medicine. The other is that the number of sleep doctors who are retiring is greater than the number of sleep doctors that are being trained. And I think the other thing is that there are other disorders that we have just started to scratch the surface of understanding. We have not gotten to a point in which we know exactly what we should be doing for each patient, but we need to get to that area fairly quickly.
It doesn't matter what your background is, you will learn in this fellowship. You will learn everything you need to know for sleep medicine. There's so much work to be done, And I think the expectation is around that hope because we've already seen that growth in sleep medicine, so it's just a matter of time before we see these wonderful things happen. We've really seen a lot happen in the last couple decades. It's quite incredible.